Hi, welcome to Ames Responds to COVID-19, a question and answer program where Ames area organizations respond to COVID-19 questions. I'm Susan Guiasa, the Public Information Officer with the City of Ames. My guests today are Steve Sullivan, Director of Marketing and Community Relations with Mary Greeley Medical Center, and Andrea Cardenas, the Health Action Coordinator with the City of Ames. I don't have specific questions for today's show, but instead I wanted to touch on some topics of concern that I hear out in the community. This is the time of year, late July and early August, when we see a lot of Iowa State University students returning to Ames. One of the biggest concerns surrounding the COVID-19 pandemic is overwhelming our healthcare systems. We have seen the number of positive tests in Ames go up and down, but generally we're seeing a bit of an increase. My first question goes to Steve. Do you feel that Mary Greeley Medical Center has been able to respond to the increase in COVID-19 hospitalizations? And are we seeing more people hospitalized?
We've seen a gradual increase in COVID-19 patients over the past couple of weeks. For a while there, we were averaging maybe 5 or 6 a day. We've had as high as 15 in the past week. So we've been kind of averaging around 12 or 13 probably over the past week or two. So we have seen a gradual increase. Concurrently, however, we've seen a significant increase in medical patients, non-COVID-19 patients. So the hospital is very busy, but it's not because of COVID-19, it's because of all of the other patients. So it's also important to keep in mind that we've been preparing for surges of patients since the beginning of all of this. Back in January, we started putting plans in place. So our ICU staff is very versed and experienced in treating these patients. Our nurses and others on the inpatient floors that have been designated as COVID-19 patient areas also are very experienced.
And are you seeing a direct correlation between the increase in positive tests and hospitalizations?
No. While during the course of this, we've had people from all age categories treated for COVID-19, from children on up. But the increase in positive, which has been fairly significant in that, I believe, 19 to 34-year-old age range, that age range that you would consider college students to fall into, has not necessarily correlated with increase in inpatient. Where we're primarily seeing inpatient is with that older adult group, 40 to 50 and older. That's driven in part, especially the elderly population, by COVID-19 cases in area long-term care facilities.
And I think it's important to note that at Mary Greeley, you're a regional hospital. So patients who are hospitalized, that does not necessarily mean they're from Story County.
No, we draw from our primary market area is a 6-county market: Boone, Greene, Hamilton, Hardin, Marshall, and Story. So that's our primary, but we're drawing from throughout the central Iowa region. You kind of imagine Story County and then a horseshoe of the region around Story County is where we're drawing from. And so, yeah, we are drawing Marshall County, for example, as a pretty significant number of COVID-19 cases, and we have seen several patients from Marshall County.
Just as a follow-up, Steve, are you concerned about healthcare access with the influx of Iowa State University students we're seeing now and in the next couple of weeks?
Of course, I think, like everyone in the community, where we have concerns and how we need to be watching that and monitoring that situation. Again, that age group doesn't necessarily translate into hospitalization, into inpatient situations. It could, but it does. I don't think we expect this influx of college-age students being inpatients in the hospital. I do think it's going to put a significant amount of pressure on testing capabilities in the community. And some people are going to turn to the hospital, but right now we're not just providing tests outside of people who are here for inpatient treatment or who are coming in for outpatient procedures. But I think that's where the big stressor is going to be. The university is providing testing for a certain segment of their population, but that's certainly not going to cover everybody who might be coming back this fall.
Sure. As we know, the university is going to test all students in the dormitories, and that's thousands of students that they'll be going through on those tests.
Yeah, nearly 10,000, yes.
Thank you, Steve, for that kind of big picture feedback. Now let's get a little bit smaller. Andrea, you are the health promotion coordinator with the City of Ames, and your focus is on the City of Ames workforce, specifically in keeping employees healthy. One of the recent responsibilities you've been given is being a contact tracer. We hear about that a lot. Can you explain to us what is contact tracing?
Sure. Contact tracing is where you identify cases of the illness, so in this case, COVID-19, and you isolate those cases so that they're no longer out in the community and spreading illness to others. You can identify any potential close contacts that could have been exposed to that person who is ill. So close contact is typically defined as 15 or more minutes within 6 feet of the person that tested positive, and it starts 48 hours before symptoms developed. So, our contact tracing program kind of started out of the requirement from the Iowa Department of Public Health to track all employees that are out with symptoms of COVID-19. So that is a responsibility of mine. So if someone calls in sick, a supervisor asks a few questions to determine if someone has symptoms of COVID-19. And then they contact me and I interview that employee. So normally contact tracing starts after a positive test. In our case, it starts with symptoms or possibly even an exposure. And I work with that person throughout the entire process. So I might be helping them find a place to get tested, following up with them to see what their symptoms are, identifying who they could have been in close contact with during the time when they could have been contagious. So we're actually able to get ahead of the illness and quickly isolate people that could have been exposed but are potentially contagious to others, and make sure that they stay at home and they're not out in the community, and they're limiting their interactions if they do have to come to work.
Yeah, you were talking about some of the training that you did to become a contact tracer. Share a little bit more about that.
Sure. I have a background in biology and a degree in public health. And so I have some basic understanding of epidemiology and how illness is spread. And in addition to that, the CDC has a protocol for contact tracing available. So we took their protocol and adapted it. Johns Hopkins University also has an online program to learn how to be a contact tracer. So in addition to all those other items, I also did that online training to make sure that I was following all the processes correctly.
So your work focuses specifically on the City of Ames workforce. If you were a resident of Story County, how might contact tracing work for you?
Right. So once you've been tested and you're notified that you have a positive test, either someone from the Iowa Department of Public Health or your local county health department will reach out to you and work with you to identify, when your symptoms started, who you might have been in close contact with, and then initiate that process from there.
Okay, great. Very helpful information. We're hearing a lot of kind of chatter on the streets about this vocabulary, contact tracing, increasing testing, positive cases, and of course, throw in there the start of the fall semester, and there's just a lot of questions out there. So thank you to my guests, Steve Sullivan and Andrea Cardenas. Just a reminder, are you a Cyclone Who Cares? The City of Ames, along with Iowa State University and other local organizations, including Mary Greeley Medical Center, is partnering for a community-wide public health initiative called Cyclones Care. The entire campaign focuses around 4 pillars of healthy decision-making, including wear a mask, stay home if you're sick, frequent hand washing, and physically distance from one another. If you want to learn more about Cyclones Care, you can find more information on the Iowa State University website or on our City of Ames website at cityofames.org/COVID-19. Ames Responds is an opportunity for Ames residents to ask their COVID-related pandemic questions. If you have a question for us, send us an email at covid19@cityofames.org. Finally, please remember we are living in rapidly changing times. The information we provide today is the most accurate that we have, but it could change. Please remember to continue to check reliable sources for your pandemic information and also the City of Ames website. Thanks for watching.